This is a question I get often because a lot of balding happens at the crown, and that's where it starts to become apparent. Most people find that the crown is where their friends have told them they are starting to lose hair, so they become very self-conscious that someone might be behind them looking at that crown all the time. If you're a young man who's experiencing crown loss, your first step should be medical therapy instead of surgery. And the reason for this is that crown may continue to expand. In other words, if you have a crown about this size and it continues to get to this size, if I transplant hair that is permanent to the center of that crown and fill it in for you, but we haven't stabilized the fringe, you're going to end up with a ring of baldness around it, and that does not look natural. So even though you can transplant hair to that area, it is not wise to do so. So medical therapy is typically the first step. Some doctors even have a cutoff, an age cutoff below which they will not transplant hair to the crown. Now, if you're somebody who's a little bit older, who doesn't really have a lot of frontal hair loss, and the crown is really what bothers you, there might be some options. You can transplant a crown. The other reason a crown is problematic is because the back of your head is not like the front of your head. The back of your head is a curved surface. The front of your head, the hair kind of shingles. It kind of lines up one behind the other, so you get a nice forest effect, where there's an optical illusion that the hairs behind are providing coverage for the hairs in the front. On the crown, that's not exactly possible. Because it's a curved surface, all of the hair kind of radiates out, and so you're kind of trying to carpet a basketball with a piece of shag carpet. When you bend it, you can see down to the bottom. So one of the things I heard that I have always latched onto during my training was that the crown is the black hole of hair. It takes a lot of grafts to make a crown look really dense and filled in. Now, that being said, you can do quite a bit with a crown to achieve better coverage. If you're somebody who likes to comb their hair back and have a bald spot at the crown where the hair doesn't necessarily stay, and you've been using lots of products to keep that in place, you can use what are called tackers, little tacking hairs, to kind of lock those hairs in. And there's a bunch of different options. You can fill in and make the crown smaller. A lot of older techniques involved reducing that area, scalp reduction, that is typically not done because there is some stretch back, and then you leave a scar in the crown. So that is not the best option, but there are options for crown loss. So my best advice is for you to go ahead and see somebody who specializes in hair, who's been doing this for a while, who does it exclusively. And the reason for that is because these are people who will understand the natural progression of the balding pattern that you might have to deal with, and be better able to predict kind of what your options are. So yes, you can fill in the crown, and those therapies include both medical and surgical. But no, I wouldn't jump into that one with both feet right immediately.